What's the artery?
Pulmonary
The
veins.
Brachiocephalic.
Brachiocephalic.
Come on!
Come on. Going into
Gosh.
what?
It goes to the
Superior vena cava. So that should not be that hard.
No, because they're
Okay, what would these be then?
that's the carotid.
No.
Jugular.
Jugular veins.
Oh man.
Internal jugular veins, probably. I don't think they have the external here. Internal jugular veins, and this would be the
Subclavian.
subclavian vein with the internal jugular vein
Internal
become
jugular.
the brachiocephalic vein.
Brachiocephalic.
And the two brachiocephalics become the
Brachiocephalic trunk.
superior
Superior
vena cava. You guys got to work on that. That's kind of basic.
And that couldn't have been named it the carotid vein.
No, they call them the jugulars. There's no jugular arteries. There's no carotid veins. Okay?
I'm already.
Okay.
I'm not perfect, bro.
Okay.
I can dig
And the umbilical vein coming up, the inferior vena cava coming up below the inferior. Yeah. So we have the inferior coming up, the superior coming down, and then the opening to the coronary sinus. Okay. Now leaving, remember we had the ascending aorta. First branches off are the
pulmonary veins.
no.
Coronary arteries.
Coronary arteries to feed the heart.
Right, they get first crack at the
Yeah.
oxygenated.
And then this is the aorta. And then when we get to the aortic arch, we have the ABCs, right? Aortic arch, brachiocephalic trunk,
Left common
left common carotid, left subclavian. The pulmonary veins that you're talking about are coming back to the left side of the heart.
Oxygenated blood.
Then coming down, we have the thoracic aorta and abdominal aorta. What's this branch here? Celiac trunk. Okay, what does it go to?
It goes into the spleen and the
Splenic.
and the spleen and the adrenal
Gastric.
No, stomach and the liver.
and the liver.
Hepatic.
Okay. And then this is the
Superior stomach
superior mesenteric.
Mesenteric.
Okay, and it feeds a lot of the beginning, more earlier parts of the GI tract.
Inferior.
This is the later parts. Okay, and then the
Common iliac.
common iliac divides into the
Internal.
and external. The external becomes the femoral, which becomes the popliteal.
Yes.
And
then the
two
tibia.
the anterior tibial, the posterior tibial, and the peroneal. Okay. And the anterior tibial also becomes what down in the foot?
Dorsal.
Dorsalis pedis, which is an important artery for making sure that you're getting
Lower
circulation.
circulation.
Okay. Coming back, same sort of thing, except we have tubes, usually two veins for each. And those are the deeper veins. The arteries usually are paired by veins. Arteries tend to be deep. Veins tend to be either deep or superficial. If they're deep and accompanying arteries, they usually have the same name, but it's usually two of them instead of one. And so we have two anterior
And posterior.
tibial, and two posterior, and two peroneal. And then we get up to the femoral, right? We also have some superficial veins, like the small saphenous and the great saphenous. Why is the great saphenous important, and where is it located?
Isn't that
The
the
medial.
greater?
That's the one that's along
The
here.
greater one, yes.
The great saphenous.
We use it for bypass surgery.
For bypass surgery. Also, if you're on prolonged IV. Okay.
For nurse.
And so the internal and external become the common iliac veins. They become the
Inferior vena cava.
And then we also have, you can see the
Renal
renal
veins.
arteries and renal veins here. Okay. Now there's a bypass in the thoracic region for the inferior vena cava and for also the hepatic vein. What is that called?
I don't know.
No, that's not what it's called.
None of the above.
Starts with an A. Azical system. Azical system. That's a bypass. It drains the thoracic region, but it's also a bypass in case there's a blockage.
Yeah.
Okay.
Yeah.
Okay, so go study some more.
We take this away?